Good morning, everyone. We're from SDDB7, the fourth semester of PSSK 2021. Today, we will present our student project presentation, which title is Retinal Vascular Occlusion. Next. So these are our members. Next. Now I'll explain the introduction. Next. My name is Ledwin Meikel Wibisono with the last three digits of student number 061. And now I'll explain about the introduction. Next. So the eye is an intricate organ with numerous microscopic organs that are required for vision and eye movement. So eye is important in our body, and an injury to the eye can cause pain, disorders, or vision problems to the eye. So one of them is retinal vascular occlusion. So retinal vascular occlusion is a serious, possibly vision-threatening disorder in which the vasculature of the retina becomes occluded. So there are two types of retinal vascular occlusion, which is retinal vein occlusion and retinal artery occlusion. So RVO is the second most common retinal vascular disorder in the world, and meanwhile RAO is more recognized as an ophthalmic emergency and the ocular analog of stroke. So the prevalence of RVO is estimated to reach 28 million people in 2015, and RAO is estimated to occur in 48 people per 100,000 people per year in the world. So RVO can occur when one of the retinal veins become occluded, and RAO can occur when the retinal arteries of the eye become occluded. So retinal vascular occlusion, RVO and RAO, is a serious medical condition and needs immediate treatments to avoid a serious, potentially vision-threatening condition. So based on the urgency and background above, it is very important for us to know more and comprehensively about retinal vascular occlusion. That's all from me. Thank you.
Hello everyone, my name is Kusuma Mulya with the last three digits number 151. Here I would like to present the problem formulation, objective, and benefits. Next slide, please. So the problem formulations here is what is the definition and classification, epidemiology, etiology, pathophysiology, signs and symptoms, diagnosis and complications, and prognosis of retinal vascular occlusion. Next slide, please. So the objectives here is to understand the definition and classification, epidemiology, etiology and risk factors, pathophysiology, signs and symptoms, diagnosis and management, and complications and prognosis of the retinal vascular occlusion. Next slide, please. So the benefits here is for the writers. This paper can be used for educational and teaching resources and practicing in developing skills to conduct the research, and improving literacy skills by searching through dozens of journals. For the institution, adding educational material sources of knowledge and can be used as references to retinal vascular occlusion, and for public community, introducing and educating, increasing public awareness and references to know more about retinal vascular occlusion. Thank you.
Hello, my name is Marta and my digit of student number is 064. Now I'll talk about the definition and classification of retinal vascular occlusion. The presence of a blockage or destruction of the retinal blood vessel can be referred as retinal vascular occlusion. This can interfere with vision because the blockage that occurs causes blood flow to be obstructed or clot forms. Retinal vascular occlusions can be divided into two types. The first is retinal artery occlusions, refers to the blockage of one or more retinal arteries, and it can lead to a sudden and often painless loss of vision. There are two main types of retinal artery occlusion. First, central retinal artery occlusion and branch retinal artery occlusions. The second is retinal vein occlusions, refers to the blockage of one of the retinal veins. When a vein becomes occluded, it can lead to various symptoms and vision problems. There are two main types of retinal vein occlusion. First, central retinal vein occlusion, and the second is branch retinal vein occlusion. That's all from me. Thank you.
Okay, let me introduce myself. My name is Wijaya with the last three digit of student ID number 227. And I would like to explain more about the epidemiology of retinal vascular occlusion. So, retinal vascular occlusion is a common cause of visual loss or disability, especially toward middle-aged and elderly population. There are many terms to be known regarding the types of retinal vascular occlusion. As you can see on the left side of the slide, there are branch and central RVO, and there are also central, branch, partial, and transient RAO. As a whole, RVO is the second most prevalent retinal vascular disease in the world, globally affecting 28.06 million people between the age of 30 to 89 year old by 2015, with an annual average of 48.31 per 100,000 individuals. As a note, almost 90% of patients with RVO are older than 50 years old, making it much more common in elderly people. On the other hand, the annual incidence rate of RAO only amounts to 6.63 per 100,000 individuals on average. Additionally, BRVO and TRAO are much more prevalent in females than in males. Comparatively, CRVO, TRAO, BRAO, and CRAO are more prevalent in males than females. That's all from me. Thank you. Next.
Okay. Hello, my name is Devi Prastiti with last three digit number 028, and I would like to tell about the etiology and the risk factor of retinal vascular occlusion. Next slide. So, retinal vascular occlusion consists of artery and vein occlusion. Firstly, retinal artery occlusion can be caused by atherosclerosis or embolism. Atherosclerosis is a condition in which plaque accumulates on the inner linings of the arteries that make it hard for the blood to pass through them, while embolism is a condition when small pieces of atheromal plaque flows together in the blood and cause obstruction. The same thing could happen in retinal vein occlusion. If a person has atherosclerosis, which causes the retinal arteries to narrow, the hardened arteries may press against the surrounding veins, causing the veins to constrict and disrupt the flow of blood through them. And even though the precise cause of this isn't always understood, there are various risk factors that may obstruct the blood flow, such as obesity, hypertension, hypercholesterolemia, diabetes, stroke, and myocardial infarction. I think that's all for me. Thank you.
Hey, good morning. My name is Putri Arsawardani Putri with last digit number 027, and I will explain about the pathophysiology of retinal vessel occlusion. So there are two types of retinal vessel occlusion, namely retinal artery occlusion and retinal vein occlusion. Retinal artery occlusion is most commonly caused by embolism. The lodging of an embolus in the retinal artery leads to hypoperfusion of retina, retinal ischemia, and rapidly progressing cellular damage. This blockage eventually results in necrosis and vision loss. On the other hand, retinal vein occlusion is typically caused by thrombosis. Any factors that promote venostasis, hypercoagulability, and endothelial damage may contribute to thrombosis and subsequently retinal vein occlusion. Anatomically, the retinal vein and artery share a common adventitious shape. Atherosclerosis of retinal arteries that results in thickening of arterial walls can compress the retinal vein. Compression of the retinal vein may lead to turbulent blood flow, which increase the risk of thrombus formation.
Okay, thank you for the opportunity. My name is Wilbert Purnamsidi with the digit of my student number S125. And now I will explain about signs and symptoms of this disease. Next. So, retinal vascular occlusion. This disease has two types. The first type is retinal vein occlusion or RVO, and the second one is retinal artery occlusion or RAO. The signs and symptoms of RVO, such as reduced vision, pupillary defect, reduced color vision, decreased visual acuity, blood and tender appearance, cut and wall spot. The signs and symptoms of retinal artery occlusion or RAO are sudden and painless loss of visual acuity, peripheral vision, retinal edema, cherry red patches, and slow segmental blood flow in innervated retinal arteries. Maybe that's all from me. I give it to my friend. Thank you.
My name is Ariela is Rahardjo with last digit name 247. Next. Now I will explain about the diagnosis of retinal vascular occlusion. Fundus examination and fundus photography are important methods for the preliminary evaluation of retinal vascular occlusion. Other imaging diagnostic methods such as fluorescent angiography or FA and optical coherence tomography or OCT are also widely used for detection and evaluation. Clinically, FA allows evaluation of fluid staining along vessel walls, the extent of capillary non-perfusion, and the degree of muscular ischemia, and enables differentiation between collateral vessels and new vessels. OCT is useful to confirm and quantify the severity of macular edema, assess the integrity of photoreceptor layers, and monitor response to treatment. Central retinal artery occlusion is a medical emergency. On fundoscopy, the retina will appear diffusely pale that indicates retinal edema with a cherry red central spot. This spot results from underlying normal choroidal circulation. Narrowing, box scarring, or segmentation of arterioles also may be appreciated. If symptom onset is less than 6 hours, a CT head without contrast should be obtained to rule out intracranial hemorrhage. Patients with central retinal venous occlusion typically present with a history of unilateral acute painless visual loss. Dilated fundus examination reveals flame hemorrhage in all quadrants, resulting blood and tender fundus appearance. The macula may be edematous. FA may help to confirm the diagnosis of central retinal venous occlusion. I guess that's all from me. Thank you.
Good morning, my name is Gregorius Thongiratama with the last digit of student number 085. Now I'm going to explain about retinal vascular occlusion management. Retinal vascular occlusion causes patients to have increasing levels of vascular endothelial growth factor or VEGF, which could promote angiogenesis and bleeding. Therefore, the patient needs anti-VEGF to overcome. Another drug that could be prescribed including aspirin, anti-inflammatory drugs, plasmapheresis, systemic anticoagulation, corticosteroids, fibrinolytic agents, or patients could have intravitreal injections of alteplase, triamcinolone, bevacizumab, aflibercept, ranibizumab, and dexamethasone. In addition to management, surgery could be performed for the patients in the form of vitrectomy, radial optic neurotomy, chorioretinal venous anastomosis, and laser photocoagulation, with purpose to improve the patient's visual acuity. Afterwards, patients should be followed up in 3 to 6 months to ensure good postoperative prognosis. That's all from me, and thank you.
Thank you for the opportunity. My name is Jennifer with last digit of three student number is 101. Now I'll explain about the complication. Retinal vein occlusion leads to hypoxia in the retinal tissue, and due to the continued impact of the subsequent release of VEGF and inflammatory mediators, retinal vein occlusion may progress to develop a number of structural problems. The most common complications are neovascular glaucoma, vitreous hemorrhage, and also tractional retinal detachment. As for the patient with retinal artery occlusion, ocular neovascularization may lead to further ocular complications, such as vitreous hemorrhage and neovascular glaucoma. This may result in addition of visional loss or discomfort in the affected eye. Thank you.
I will continue the presentations. My name is Felix Djuanda with the digit of student number 117. Next, I will explain about the prognosis. With the proper treatment, the retinal vein occlusion usually has a good prognosis with a good visual acuity, but without treatment, it can lead into the retinal artery occlusion can cause ischemia that has a risk of permanent vision loss. There are several imaging tools to evaluate the prognosis. There is fundoscopy, electroretinography, microperimetry, optical coherent tomography, and laser spectrography. Next.
Hello everyone, my name is Natania Sutedja with last digit of student number 175. Next. So I'm going to explain about the summary of the student project. So retinal occlusion is the presence of blockage or destruction of the retinal blood vessel, and retinal vascular occlusion is a common cause of visual loss or disability, especially toward middle age and elderly population. And retinal occlusion can be divided into two: retinal artery occlusion and retinal vein occlusion. Retinal artery occlusion can be caused by arteriosclerosis or embolism, and retinal vein occlusion can be caused by arteriosclerosis. And retinal artery occlusion can be caused by embolism that can lead into necrosis and vision loss, and then became retinal artery occlusion. And in retinal vein occlusion, there are any factors that promote events that is hypercoagulability and endothelial damage that can cause thrombosis and can lead to retinal vein occlusion. Next. So the sign and symptoms are in RVO, there are reduced vision, pupillary defects, reduced color vision, and decreased visual acuity. And in RAO, there are sudden and painless loss of visual acuity and peripheral vision. And the first assessment that you can do in retinal occlusion is fundus examination and fundus photography. And the treatment are anti-VEGF drugs and surgical laser procedures and conservative treatment. This can be followed up into 3 to 6 months. And the prognosis of the retinal occlusion, if they receive a proper treatment, there can be lead to good prognosis, and without treatment, it can lead to ischemia and risk of permanent vision loss. And lastly, the most common complication of retinal occlusion is neovascular glaucoma, vitreous hemorrhage, and tractional retinal detection. That's all from me. Thank you very much.
My name is Karralika with the last digit number 246, and now I will explain the recommendation for this student project. So first, you need to pay more attention to problems that exist in the retina by living a healthy life in order to avoid health conditions that can cause lesions of blood vessels in the retina. And further research is needed to improve the diagnosis, treatment, and prognosis of the retinal vessel occlusion. And further research is still needed to clarify systemic system. And that concludes the presentation from our group P7 in the topic of retinal vessel occlusion. We are sorry for any errors and thank you for the attention.